Hi everyone, my name is Megan Revlett. I'm an FNP student at Eastern Kentucky University. This is a project proposal relating to tailored multi-component interventions targeted for vaccine-hesitant caregivers for nursing 892. So when looking at the clinical nursing problem, the World Health Organization defines vaccine hesitancy as the delay in making a decision to accept or refuse vaccines even when they're readily available. Within the last several years, there has been a steady increase in the number of young children not receiving vaccinations, and that's by Hill et al., 2018. Healthy People 2020 has set a goal to increase immunization rates to prevent diseases. So when looking at the background and significance, literature review was conducted. Tailored multi-component interventions are shown to be effective in addressing vaccine hesitancy. A systematic review found interventions that were multi-component were the most effective in having a positive impact on vaccine uptake. That's by Jarrett et al., 2015. A randomized control trial used a multi-component toolkit in a practice and found that influenza vaccination rates increased. It's by Zimmerman et al. A qualitative study by Lockhart et al. 2018 supported the use of motivational interviewing and a presumptive approach in increasing HPV vaccination. And lastly, a cohort study found motivational interviewing utilization had a positive impact on vaccine coverage at 3, 5, and 7 months, and that's by Gagner et al. When looking further down on the poster, you can see I've included a vaccine hesitancy continuum, and this was developed by McDonald and the SAGE Working Group in 2015. And this is just a good visual to show where vaccine hesitancy lies. You can see that there you have your accepting all, refusing all, but then that vaccine hesitancy kind of falls in its own group. It's a continuum, it's not just one factor. There's multiple factors, and this is just a good tool to look at when thinking of how to use multi-components to tailor your interventions for vaccine-hesitant parents or caregivers. So the objectives of this intervention and proposal are early identification of a vaccine screening tool and utilization of a multi-component toolkit for those identified as hesitant in the primary care setting, and ultimately to increase vaccination uptake among vaccine-eligible children. The theoretical framework that is the foundation for this proposal is the health promotion model by Pender, and there is a graphic on the poster that kind of outlines the main points of that and how those are intertwined when moving through the process of behavioral change. So methods for this proposal. The proposed intervention will take place in a primary care setting that treats vaccine eligible children. A multi-component toolkit will be developed that's consisting of provider and nurse training on motivational interviewing and dialogue-based approaches, the use of a screening tool, supplemental caregiver education, and a designated office champion. Pre-intervention vaccination rates in the practice will be collected through chart reviews. The leader for this project will be the advanced practice nurse, and the multidisciplinary team will consist of providers in the practice, nurses, and office staff, and any other researchers that may not be a part of that group. So the interdisciplinary team will plan training sessions for providers, nursing staff, and office staff regarding the use of the multi-component toolkit. This will include training on the motivational interviewing techniques, the dialogue-based approaches, the office staff giving the screening tools to parents whenever their children come in for well-child visits. All caregivers will receive the Parent Attitudes About Childhood Vaccines survey. It's by Opal et al. Those will be filled out and then reviewed by the provider before the provider goes into the room. This will guide the discussions regarding vaccines if the caregiver presents as hesitant. There is prompts to follow on the survey of how to know if the parent is hesitant and in what areas are they hesitant. Learned motivational interviewing techniques and dialogue-based approaches will be utilized, along with supplemental education materials such as handouts and other information that the parents can take with them. The office champion will serve as a point of contact for additional resources or concerns maybe regarding accessibility or eligibility, which would be looking into insurance coverage and things like that. All interactions by their provider or the office champion or the nursing staff will be documented in the child's medical record. When looking at evaluation, at the end of the 12-month implementation period, another chart review will be conducted to identify vaccination rates. The rates will be compared to pre-intervention rates to confirm or deny statistical significance with the implementation of this toolkit. From there, the team will decide if it's something that needs to be improved upon, if it can be disseminated to other practices, and beyond. An anonymous survey will be completed by providers, nurses, and office staff regarding the intervention, and caregivers will also be given the opportunity to anonymously complete a survey on how they perceive the intervention and any improvements they might have. So in conclusion, there has been ongoing evidence of the growing problem of vaccine hesitancy among caregivers of children. Several research studies have supported the use of tailored multi-component interventions in addressing these. The advanced practice nurse has the opportunity to implement these interventions in the primary care setting. With this proposed plan, the advanced practice nurse can evaluate whether the intervention is effective in their practice, and as mentioned before, they can disseminate those findings to others. The advanced practice nurse has an important role in the implementation process, along with ongoing research related to this problem. And you can also refer to the references on the poster. I would be happy to answer any questions that you all have if you just want to leave those in the discussion board or virtual office. Thank you so much, and you all have a great rest of your week.